Many patient comes to us with a viral test report that I am getting fever again and again in a year 3 to 4 times. Does it really typhoid? Are they really getting reinfection? Let's look into it. Hi, I am Dr. Moumita, your general physician. So what happened is, whenever a person is getting recurrently infection and whenever they go and do viral test, that can be positive in multiple stages. In multiple infection, it can be positive. Need not to be a typhoid fever. First thing what we have to see is, was it really a typhoid fever that he or she was suffering from? So we have to see, was there any blood culture taken at that time? How was it diagnosed? What antibiotic was given? How much duration they have taken? And after how many days now they are getting the infection again. So these are the few things that you have to see. So if it is really a culture positive typhoid, so in that case what we have to think is, was the antibiotic given was susceptible for the bacteria? Or second thing is that you have to see is, did they take it for a same duration of the time that has been prescribed? So adherence is a very common problem that we see. Though we prescribe for 10 days or 2 weeks, people will take for 3 to 4 days and they stop in between. So that is a very common thing that we see, and that is one of the reason for the treatment failure. Other things that we have to see is, if it is a relapse or it is a recurrent infection. Relapse usually happen 1 to 3 weeks after the treatment has been over. After 1 to 3 weeks, they again getting fever. And at that same time, if you do again blood culture and that is positive, that is when we suspect about relapses. So in that stage, we have to keep the antibiotic for a longer duration and we have to change or go for a higher antibiotic. Second thing is, if it is a recurrent infection, so they have been treated after 3 to 4 weeks, again they are getting, and that time also blood culture positive. So probably the source is there and they are getting infection again and again. So then we have to go for the source from where they are getting the infection. Other things that is there is chronic carrier stage. So once a person is having typhoid fever, so they are harboring that bacteria inside the body. So they will be chronically shed the bacteria in their stool. So if we keep culturing the stool, sometimes even till 6 months also the stool culture will come positive. So if the chronic area stage is there, which is happening for the epidemiological region, so that because it is spreading to the other people, and if they are in health or food industry, they are handling with food or some patients and all, yes, that need to be treated, even if it is, even if they are not having any symptoms. That we call it as a chronic carrier stage. Around 1 to 5% people will fall into that. They will harbor in their gallbladder. And we have to check, is there any gallbladder pathology or not. Some people who are already having this kind of thing, even we can plan for a gallbladder surgery for them if the antibiotic is not getting, if they are not getting treated with that. So this is very few and interesting part when a person is getting again and again fever, and every time we are thinking if every time the blood culture is positive. But if a person getting fever and they are coming with a viral test that it is getting positive, don't think that as a typhoid fever. We have to evaluate properly, thoroughly. So take care of your health. Go to your physician or doctor before self-diagnosing. Thank you.